That's a tough one. I would say that I think the more educated, not necessarily college education, more educated people are about health and wellness, the more, let's say, inspired they are to make changes in their life, the more awareness they have of their body. Because part of the interview is asking details about their symptoms, when they started, what makes it better, what makes it worse, etc. And sometimes people just can't answer those types of questions. It makes it very difficult to understand what's happened in this progression of their condition. So let's say more people that are more aware of what's going on with their symptoms in their life, etc. Um, let's say people that are more open, people that are more that understand the role that purification must play in their recovery. Um, of course, the shorter time they've had their problem, the better. Some people come in that having experienced issues for decades. Those are certainly more challenging and take much more time. People that are on minimal pharmaceutical medication makes it much, much easier. People that have avoided medication in their life, um, I would say those are the primary factors in those people that respond better. And sometimes I think, well, maybe this person of in their early 20s is going to be more rapidly improving versus someone in their 60s or 70s, but this has not always been the case. There's something magical about the mind, about the brain and the thoughts and the beliefs that we have, which have a tremendous influence. The psychology of the mind has a tremendous influence on how rapidly people are recovering. There's one other thing, and that is when a person starts going through therapies, and whether it's an IV treating pathogens in the body and there's a die-off and they feel worse, or they're going through therapies and they're beginning to detoxify and they're feeling worse. A person's attitude at that time is extremely important. One reaction would be, wow, I know that I'm on the right path because I've got these symptoms related to the therapies I'm receiving, and I know I've got to go through this to get on the other side. This was when I was at National College of Natural Medicine. We had a physician, MD, come up from Mexico who ran a cancer purification clinic, not just cancer but other things. But people would go there for 2 weeks at a time, 3 weeks, and basically the approach was juice cleanse. That's all they would do, would be to drink fresh organic juices. The idea behind that is that, again, this regulation of blood sugar. These were low glycemic juices. Regulation of blood sugar, the body is pulling fat out of tissues to then become glucose, to maintain that stability of glucose. But also, you're providing the nutrients these cells are starving for. They're absorbing all of these nutrients, and the vitality, the engine, the mitochondria is beginning to work again. And any toxins in those cells are now able to be excreted from the higher vitality of those cells. So the idea was to just have people drink juice, and eventually they're going to go through a healing crisis, which means the excretion of toxins, vomiting, stool, etc. And people realized that was the education they gave people before they came was, here's the plan. You are going to go through a healing crisis, and that is the sign or signal that you are going to go up another notch in your health. And people knew that. And the people that had been there, the story was people had been sitting around tables drinking their juice, and then somebody is off, they didn't come to the table, they were sick, and they go, hooray, finally they're in that crisis of getting these residues and toxins out of their system. Because we know it's been proven, research is the underlying issue of many chronic diseases, including cancer, is the effects of our toxins within our environment. We know that for sure. So unless we address the causes and go through the purification and nutrify the cells of the body, the person's health will not recover. So is there the best type of people to come to receive therapy? I think it really depends upon how well I can help to educate them about the process of recovering their health. So it's partly my responsibility. It's also the receptiveness of other people. They have a strong belief that, they come here like they do a medical doctor to get not a drug, that's something they can do, something they can take orally to recover their health. If that's the attitude, it's probably not going to be completely successful. Thus, my role here is to help educate people about that innate wisdom, that innate physician that we must support through purification and through various therapies.